In the spotlight. In the spotlight.
Hello and welcome to In the Spotlight. This is our podcast series where we introduce professionals such as yourselves from various disciplines within healthcare, and we discuss the transformative roles that you all play in improving healthcare in Southern California. I'm Adam Blackstone with the Hospital Association of Southern California, and we are speaking to you today from sunny Burbank, California. And today we'll be discussing hospital supplier diversity from the supplier perspective. Joining us today are Carlie Elwell, Servicon Senior Director in Healthcare, and Ivan Garcia, Managing Partner for Calidad Medical. Welcome and thank you for joining us today, both of you.
Thank you for having us, Adam. I really appreciate you inviting me to the podcast to have this important conversation about minority vendors.
Yeah, thank you for having us, Adam.
Great. Well, thank you for joining. And to get us started, I was hoping that both of you could share a little bit about yourself, about your organization, and your journey within healthcare. And so we'll start with you, Carlie.
Yeah, so it's actually funny. I'm from Burbank, where we're filming today. So born and raised here, and got my degree from Cal State Northridge in psychology. And kind of while I was going to school, worked all the random jobs that people do, you know, retail and restaurants. And ultimately found myself being a transporter working at a local hospital here in Burbank. And from there, did that for a few years and ultimately became the supervisor of the transport department. I wrangled the guys pretty well, as the leaders told me. So there was a vacancy open for the environmental services manager at the hospital that I was working at. And so they were like, hey, if you can do this with the transporters, you think you could do this with the EVS staff too? And I just jumped at the opportunity. I thought I was going to go to nursing school, but those plans got derailed. And I, came into environmental services. And so there it's just been, the trajectory has gone from a couple of different hospital organizations, ultimately landing me at Servicon. And I'm just so blessed that I've been able to find an organization that has such value alignment with where I always pictured myself. I worked for a faith-based hospital organization for many years, and what was cool to me was that it was really about the people, and it felt like a family at that facility. And so I was always kind of in search of another organization where I could find my long-term career path. And luckily, Servicon, which was founded in 1973, is a privately held organization, women-owned and operated, and has that feeling that I was looking for and so much desired out of an organization to kind of plant my roots in. So Servicon provides environmental services in healthcare. There's also different verticals such as aerospace, government, municipalities, and life sciences. And I'm really blessed to lead our healthcare team at Servicon. And yeah.
Wow,
great.
That's great.
Yeah.
Carlie, wow,
Thank you, Carlie.
a similar story.
Yeah.
I kind of started to be at the entry level as well.
Yeah.
I actually, 30 plus years. I'm getting very old, Adam. But I started my health career in the late 1980s. I started as a sterile processing tech. While I was going to college, I'd work weekends, holidays, just, to make ends meet and pay for those expensive textbooks. And I started at Kaiser Permanente as a summer youth program. So very attached to Kaiser Permanente. They helped me kickstart my career in healthcare. Then I went to UC Berkeley. I completed my bachelor's degree, completed my MBA. And then I took some leadership positions in healthcare. I was a director of perioperative services, director of cardiovascular services at a local hospital, and I've been a director of sterile processing, supervisor, manager, director for sterile processing, consultant, you name it. I've done it for 30 plus years. And then this past year, I ventured out to Calidad Medical. My partner and I started Calidad Medical about a year ago, Adam, can you believe time flies? I know Adam from a previous job where we worked together. So I had
we did.
Yeah.
Yeah. So we worked together about 6 years ago for a span of maybe 5 or 6 years. So
absolutely
small world healthcare in Southern California.
So when I started the company, I think I may have reached out to you, Adam, and that's why I'm saying time flies. And so yes, a year has passed, and we've grown tremendously. And my company, Calidad Medical, what we focus on is surgical instrument and equipment repairs. Being from the healthcare leadership side, and my partner being from the vendor side, we've kind of brought our experiences together and formed this company with primary focus of patient care, patient safety. Me being on the hospital side, I live the daily experiences of some challenges to make sure that our patients are taken care of very well. And so with Calidad Medical, I wanted to make sure that we were focused on patient safety. Although we're not just repairing instruments, endoscopes, cameras, stainless steel, scissors. Whatever we touch is going to impact the patient. Yeah. So oftentimes when we get into our day-to-day routine, we forget the importance of the work that we do. Mm-hmm. So at Calidad Medical, we make sure that we don't forget. It's a reminder that we instill in all of our employees every single day. Those scissors, that endoscope, that flexible scope, that could be your parent, your sister, your brother, your wife. It's going to be used on, and we want to make sure that it functions to the best possible ability that it can function and how it was intended to function. So we make sure that that we do not send anything out that may be compromised. And we also, being on the healthcare leadership side, I also understand the importance of it and how can it impact some regulatory things as well. I mean, you
That's
all
what
well
I was
know,
thinking
right?
about as you were talking about
Regulatory-wise,
that.
there's so many things that can go wrong.
Right.
And so we really focus on some of the things that can go wrong with instrumentation. For example, is cross-contamination.
Right.
If you have a pitted stainless steel instrument, and that means the microorganisms can get into those pitted parts of that instrument, and you can have cross-contamination.
Yeah.
So we make sure that whenever we're inspecting surgical instrument trays, that we identify those issues and resolve them right away. And the other thing we do is we also work very closely with our sterile processing teams, because they're the ones who put up these surgical instrument trays, and they have to inspect them. Sometimes there's a lack of education, lack of staffing. There's a lot of challenges that need to be addressed. So we assist in whatever way we can to make sure that they have the resources or the training. As a partnering vendor, we provide those services as well. And we also understand the importance of fractured instruments. If you have a fractured instrument that potentially could break off in a patient while it's being used, I mean that's monumental. You don't want that to happen.
Absolutely.
So our inspection process is very detailed and precise, because the last thing we want is a hospital have to report a retained foreign object because an instrument malfunctioned.
Absolutely.
So,
and you hear stories like that, right?
Yeah,
I have family members that have actually had surgical site infections due to similar things that you're talking about. So it's crucial. And not to mention keeping the sterile processing department clean, like EVS does at Servicon.
And and then God bless them, they have a very difficult job to do.
Yeah.
And so we assist however we can with that. So it's all a team effort, and all of our customers, I mean, we treat them as family and as our partners, and we really go above and beyond. And I try to use my 30-plus years of experience however I can to assist them, whether it doesn't have to be directly related to instruments. However I can help, I'm more than willing.
Well, it sounds like a lot of trust is being placed in your hands. It's a big responsibility to ensure patient safety, quality. And we talked about this when we were off air, just the fact that the end goal is to make sure that that patient is safe, healthy, and doing well. And so always keeping that connection with patients is crucial, right? Even in an organization that might not be directly providing patient care.
Absolutely, Adam. And like I said, you lived it working in a hospital environment, and I've lived it, and Carlie, you've lived it as well. So we know how important that is.
Well, I think also the fact that we've all had that hospital experience, right? So you could have done, what you're doing now for other types of organizations, but you continue to work with hospitals, and same with you, Carlie. So you have that familiarity that maybe some other organizations don't have.
Right.
Well, and I think one thing that's unique about Carlie and I is that, you know what, we started at the ground level, or entry
Right.
level. Nothing wrong with that, but
No.
Not at
we've
all.
we've lived it from there to the next step, to the next step, to the next step, and now as
Right.
vendors. So we really understand the inner workings and
Yeah.
and what's needed to be successful as a vendor.
Yeah, I think that's a really good point too. When I think about people like us that are now vendors, I hate that word, right? We're partners that have worked in-house for certain hospital organizations. Working for the hospital organization directly, don't you think it gives us such a different perspective of what, now that we're these partners looking to partner with hospital organizations, we have that perspective of being somebody that has worked directly for the hospital before. And I think that that's something that's important for prospective clients now to think about, or hospital organizations, is you've got people like Ivan and I that have done this before for them, and we have the best type of outlook to be able to deliver the quality service or the patient experience that they're looking for because we've lived it.
Yeah.
Yeah, all of that breadth of experience provides sort of a more of a bird's eye view, right? You could see
Right.
every aspect, where others may only get a certain segment of it. You guys have the breadth of that visibility.
Right.
Absolutely, Adam. And you know what? We use it as a competitive advantage. Whenever I'm
Absolutely.
presenting the service that we provide of surgical instruments, I make that connection because I've been there. I've been on the other side, and I know what's important, and I know the impact that it can have. And I'm able to speak their language. It makes a big difference.
Right. I think in order to do so, it's like finding the right people to talk to for us, right? Being diverse suppliers, it's like, who are those folks that we're supposed to reach out to? It's not always the C-suite people. It's those high, deep, and wide relationships. So we can connect with people that really understand the work that we do and finding it meaningful.
Well, that was going to be one of my questions, so I'm glad that you segued into that. Ivan, what's your experience been like when reaching out to hospitals or trying to establish relationships? Who have those people been? How have you made connections?
Yeah, well, my experience, Adam, has been it's really, there is no best relationship or person to connect with. I think you try to connect with as many members or as many people as you can in that organization. It can be from entry level to the C-suite, because sometimes you'll get a response, sometimes you won't get a response. But really, it's just knocking on the doors and continue to knock on the doors until you get a response from someone. Some places are easier than others, of course. I know maybe minority vendor is not minority vendors are not the top priority on their list. I understand everyone's very busy. Again, it's just important that you keep knocking on the doors at all levels, because every single relationship is important and will benefit you at the end. Recently, I've been sending out emails to diversity, equity, inclusion officers, and that's been very helpful, actually. I've got a template where I've kind of prepared all the key information, and in some instances, I've gone as far as sending out the HCI purchasing information to that DEI person, so they really understand where they stand as far as their percentage of spend on minorities.
Thank you for that. I think to level set, maybe it's important that we note that in 2019, Assembly Bill 962 passed, which requires hospitals to increase their engagement and partnerships with diverse businesses to benefit California's marginalized communities. And so Communities Lifting Communities, or better known as CLC, as you guys know, this initiative aims to go beyond just a mandate, right? And that's to educate hospitals, but also communities on the importance of diversifying their procurement practice. And so I'd like for both of you to share what your experiences have been like with CLC. I know you've attended several events, and how that might have benefited your organizations.
Yeah, so we're new to this partnership, but I think it's been amazing. I was able to go to the annual conference as well as one of the diversity supplier events, and to make those connections with people that I wouldn't normally think to make connections with. It's interesting too and exciting that this is really a newer thing for all of us. Most of the leaders in those organizations that we connected with had been employed with the organization for about a year to even somebody was like a month into their program, and many of them are solo. They're the one person that's starting to start this process at their organization because everybody is finding the benefit and importance of it. So I just think bringing us together, making connections like Ivan and I are able to make with other vendors too is crucial. We have to be there to support one another. I was actually able to connect with one of the suppliers at the diversity event and, connect with him and see what was important to him, where his pathways were. Maybe I could connect him to somebody that I know. And I think doing networking within ourselves at those events too have been really, really valuable.
Great. Thank you, Carlie. What about you, Ivan?
Oh, wow. I can't say enough about HASC and CLC and the assistance they've provided for our business. I want to give Karen Ochoa a shout out. She's been outstanding and very helpful. Being a minority-owned enterprise, it comes with its challenges, and CLC has been outstanding. I've attended several of their events where I've been able to connect with a lot of the C-suite or VPs of supply chain or DEI officers that I normally would be a monumental task to try to get an appointment with. So I'm able to meet with 5 or 6 different representatives from different organizations all in one day.
Yeah.
And to me, that is incredible.
Yeah, I think it's too, since COVID, things are so different, right? Because during COVID, we were all isolated. It was all these Teams meetings, all the Zoom meetings.
Correct,
Nobody was
correct.
face to face. So to be able to come together in person at these events is also really valuable because like Ivan said, you can send all these emails or these cold calls, but really we're in a people-centered, or like what we do is people-centered.
Right.
So, coming from behind a computer screen is just such a different experience than when you're able to like make eye contact with someone, shake their hand, and make that human connection, because ultimately that's what we're here for anyways. And I think that it's really cool that HASC is able to allow us to do that in this way.
Well, and Carlie, have you tried to get in a hospital and meet with someone without an appointment? Have you had any challenges? It's
of course.
Security is top notch. You cannot even get to a hospital nowadays without an appointment. So it's you can't really knock on that door.
Well, it's great that you mentioned just the interconnectivity and the relationships. In fact, well, first of all, thank you for attending those events and making them what they are. In fact, we actually have a 2024 Supplier Diversity Conference that CLC and HASC is hosting September 26, 2024 in Montebello, California. So I hope we see both of you there.
Can't wait to join.
Absolutely, Adam. I put it on my calendar as soon as I heard about it. So it's been there for a while.
Well, thank you for that. And for our listeners, you can go to hasc.org and you'll be able to get more information there. This has been a great conversation so far. I want to know what some of the biggest hurdles have been actually, first let's start with you, Ivan. What have been your biggest hurdles, because you're a new company, right? It's your early infancy stages. It's been a year. And maybe you're the best person to speak to this, and then we'll kind of go to Carlie to talk about the other perspective from an organization that's established.
Well, I think one of the biggest hurdles or obstacles that we've faced is really just making those connections. So like I previously stated, CLC has helped us tremendously with that, number one. The other thing is education of the Assembly Bill 962. We've been having to do a lot of education because people are not aware. And I know that bill was passed in 2019 by Governor Newsom, but I don't think it's necessarily a high priority for a lot of healthcare organizations. So we have been doing a lot of education, and really when people hear about it, they're surprised of when I state numbers. When I let them know that, oh, did you know that your minority spend is only 1 to 2% of your total spend? And just like when I saw that, I was surprised,
Right.
especially in California, especially in LA County.
Yeah, exactly.
When the 75% of the population is of color.
And I'll give you this number: 50% on average percentage of patient revenue that hospitals receive in the greater LA area is received from the Latino population.
Yeah,
Absolutely.
absolutely.
And right, I'm Latino, so that hits home, right?
Yeah.
And yeah, so I mean, we have a lot of work to do, and we have to work together with the hospital leadership, with all the different organizations to promote and make sure that everyone understands what this bill is about and the importance of it. Because at the end, we all benefit, right? The vendors, the patients, the hospitals, everyone benefits. So it's just the right thing to do. And I think it's important that we all have a seat at the table.
Right.
Absolutely. I think Servicon, too, has been working on educating prospective clients on the bigger organizations aren't always better, because Servicon is privately held and women owned and operated. Yes, we meet those metrics. However, it's explaining why that's important. We are local. We are able to be agile and flexible to your needs at your organization. All of our leadership is here within Southern California. So any of you SoCal hospital groups, like we're here. We're not, a phone call. I've worked for other organizations where my HR team or my TA team was in New York and they had no idea what was going on here in LA County. Whereas my TA team is right here in my backyard, and we're able to bring really strong talent to our organization. In fact, being women-owned, certified women-owned and operated, it's interesting how many people, leaders in healthcare, I've been able to interview that are so excited to work for an organization that just has that something different and has that connection. And not to mention, I think being local and having that lower turnover has also helped us achieve a lower turnover in our frontline staff, which turnover, especially in healthcare, is one of the biggest struggles. Nursing, the nursing shortages, like being able to think outside the box, because we can, of what can we do to support the nursing staff more that maybe one of these larger organizations can't. So breaking through those barriers in our conversations with prospective clients is what's helped us.
Absolutely. In my notes here, I have greater innovation and value through cost reduction, better contract terms, conditions, and improved service, and the ability to remain nimble for some of our smaller businesses. I know we're all familiar with GPOs, some of the larger organizations, but being an organization, much like both of yours, you're able to provide those services. And education. Earlier, you talked about education, which is critical.
Right. Absolutely, Adam. And I've heard a couple times, one of the misconceptions is because you're smaller, you're going to be more expensive. And that's not necessarily the case.
That's right, Ivan.
And because we're local and we're able to provide better service because we're locally based, and you're giving back to your own community.
Yeah.
So everyone benefits in that case. And we're just as competitive as, at least in my industry, as any other huge organization that we compete against.
Oh, absolutely.
And oftentimes it's that same David and Goliath story.
Yes.
Where I'm competing with this huge billion-dollar corporation.
Yeah.
And little old Calidad Medical. But you know what? We stand for what we believe in and the service that we provide. And nine times out of 10, we beat our competitors in every aspect.
I think it's just having that transparency, right? And it's not always about the dollar value of things. You have to look at it with a holistic view of what is the quality that you're getting, because also the quality that you get from a larger organization isn't always better. So I think you're absolutely right. Keeping that transparency, staying flexible and agile to what the client's needs are. 100%.
Absolutely. Yeah.
As well as economic output, right? When you're contracting with diverse businesses, that economic output is, usually helping the community the hospital sits in oftentimes.
Absolutely. It's a multiplier effect, right?
Yeah, and Servicon, even whatever organization we're servicing, we partner with them to see which charitable communities they are, or charitable organizations they're servicing. So we have Servicon Cares as our philanthropic arm of Servicon. That way, whatever location it is, we're giving back to that actual community that we are serving, not just to give the clients what they need for the hospital, but also to service the patients in that community.
Well, and I think it's important for hospitals to note that they could use, as their diversity supplier spend increases, they can use that as a competitive advantage as well, right? People want to work in those kind of hospitals that really focus on diversity. And we all know this day and age is so difficult to recruit and retain employees, that, this should kind of come to the forefront for them, because you're going to get people who are going to want to stay with hospitals that really reflect the demographics of those same patients that they serve.
Absolutely.
Yep.
Well said.
Well said.
Thank you.
All great points. Going back to, we talked about CLC, your relationship with CLC and HASC, but let's talk about the lessons learned, best practices for other diverse vendors out there. Anything that they should focus on, maybe that they might not be top of mind for them?
I would say be people relationship focused. Don't be so sales focused. Because at the end of the day, we are there to meet the needs of our prospective clients. And I think people get really caught up in like the numbers and like, what are we selling? How are we going to grow? And then they lose the sight of the why and what it is that we're actually offering. So I would say that's the biggest lesson learned for us.
From my perspective, I would say don't give up. Keep knocking on those doors, and someone's going to respond if you're having trouble getting a response. And reach out to your fellow vendors, because they may know something that you may not, that would be very, very valuable in helping you. And always live by the rule of paying it forward. So I'm an open book.
So true.
This is LA is a
huge.
huge.
You're here.
Exactly.
Helping our other.
LA is a huge market. I mean, there's plenty of business for all of us to thrive.
Yeah.
So
that's so true. Richard Mendezian, who's the founder of Servicon, he founded Servicon in 1973, and the paying it forward aspect of things, it wasn't just about employing people to clean, right? He started in aerospace when he worked in the the Air Force. But he was able to give back to the frontline staff also. So if he heard that somebody was in need, he was able to provide them with assistance. And I think also offering those added benefits to your organization and the people that work for your organization makes us a little bit different, because again, you get the standard benefits at any organization. Some organizations have an employee assistance program, but what else can you offer your employees? Because they're the ones that are helping. They're the front line. They're the ones that are supplying the care to the patient, or the experience to the patients, to our clients. So what else can we do to offer things to make our employees happy, because they're going to end up caring for the client and the patients.
Absolutely.
Putting the people, making the people a priority.
Right.
Relationships, people, priority, it's hand in hand.
Well, and even take it to the next level, right? For example, the service that we provide, the surgical instrument equipment repair service. I mean, it has a lot to do with employee satisfaction, physician satisfaction. If that instrument that we repair doesn't work and the physician's ready to use it, he's not going to be too happy. And so it all kind of connects. And so not only for making sure that my employees are happy, but also the next step of the service that we provide and how that impacts their employees.
Awesome. Well, this has been an excellent conversation. It's actually flown by, and we're at the end, but I do have one last question, and that's if either or both of you have any last parting words of wisdom that you'd like to share with our listeners and our members.
Sure. I would just say that, diversity supply isn't necessarily just a metric to meet. It's not just this number that you need to get to. It's much more valuable than that. Having creative minds and different perspectives of folks that are actually the population of the patients that you're caring for makes a huge difference in your organization that maybe these larger corporations aren't able to make. So consider that when you're looking at diverse suppliers. Look at what their value is that you cannot get from these larger organizations.
And then I'll add to that. Really, my message to everyone is get involved, make a difference. Every little contribution that you make is going to help someone. As I mentioned earlier, a lot of these the hospitals' minority spend is 1% to 2%, and in LA County, which is pretty low. And I think there's a lot of opportunity. So get involved and make a difference because there's definitely room for improvement.
Absolutely. Well, I just want to express my gratitude on behalf of HASC and CLC. This has been an amazing conversation. I'm sure our listeners, our members, other diverse vendors out there will really appreciate hearing all of this, and we look forward to working with you even closer in the future, and of course, seeing you at the conference.
Absolutely.
So thank you very much for joining us today.
Thank you, Adam. Appreciate you having us here.
Yes. Thank you, Adam, very much. Appreciate you having us here. Yes.
In the spotlight.